what are the new liabilities that physicians might face in general as a result of the coronavirus pandemic?
So there's the obvious, the failure to diagnose COVID, the transmission of COVID within the healthcare setting. Um, we've actually received a few claims of patients who said that they contracted COVID from going to a provider for a routine visit
Hmm.
at the very start of the pandemic. We've had other providers advise us that they've tested positive and have had to go ahead and try to notify all of their patients to do contact tracing. So those are the obvious ones. Then there's everything that I'm calling a contextual COVID claim. It's really the situation of anything where treatment has taken place from, say, mid-March to really present day, where the context that surrounds the care that's being given is of course being influenced by the pandemic.
Yeah.
So it's, not being able to get in to see providers in person because they're now, even as they reopen, only seeing a few patients, in a day. One patient can only be in the waiting room at a time. So all of these things are going to contribute in the long run to failure to diagnose claims, delays in diagnosis of cancers. There's also been this sort of ancillary effect of people not seeking care when they needed it during this period of time because they've been told there are surges. The emergency rooms don't want to see you unless it's really critical, and if they are not able to self-diagnose and know that they're having an appendicitis rupture or having a stroke, they're not seeking care. So all of these contextual claims are things that we're keeping our eye on, and my colleagues and I are trying to monitor to make sure that we're doing everything we can to mitigate bad outcomes, protect our healthcare providers, which is really our key mission, and to make sure that they can focus on being healthcare heroes and not worrying about negative outcomes down the road.
Now, you mentioned that patients might not be going to the practice for various fears, but in the event that one does, and it's outside of the scope that a physician normally practices in, if the physician does decide to engage with that patient and treat them, what would be the liabilities in that case?
So in a typical setting, if a provider is practicing outside of scope,
Hmm.
there may be some liability there if something untoward happens. We talked a little bit before we met today about the new legislation that's been proposed on Capitol Hill, and that should prevent that type of litigation from being pursued. It should provide immunity as long as that scope of practice is reasonable. If it's outside the scope of that provider's practice, is similar to a provider whose scope of practice is akin to his own.
So, while bringing patients back into the practice, how should physicians be triaging those patients and the best way to avoid, any liability claims in the future?
So we recommend that providers really take a moment to not just rebook based on when the appointments had been canceled, but to very thoughtfully triage and see the patients in person who need to be seen most urgently, patients who have who maybe aren't as compliant with their care, and to really do some aggressive risk management in terms of making sure everybody gets in, and also having very cohesive systems in place to make sure that everybody gets seen at some point in the near future, being mindful of the fact that things may revert at some point as well. Again, we hope not. But if they are unable to see any patients again in person for preventative care, that they have a really strong diary system, tickler system to bring the patients in.
So, what are some steps that physicians or providers can take to protect themselves from these liability claims?
So one of the things that we've been recommending to all of our providers and facilities is to keep very detailed records of what has happened in their practice during this period of time. medical malpractice is a long tail business. And if by the time, if claims are brought, by the time any of them see a courtroom, it'll be years from now. And if we're lucky as a society, COVID will be very, very distant in our rearview mirrors, and we won't be able to remember what things were like at this period of time. So we're recommending that providers keep track of all of the critical times and dates and the content of key events, any physician or other staffing shortages at that facility, anytime they were rationing or short on PPE, anytime that the, either state or local or even facility regulations limited practice in some way, any communications that went out to patients, the first time you were able to send somebody for a COVID test, the first time somebody tested positive, and really just keeping a linear sort of layered timeline of what was going on within the practice, within the locality, within the state, and even within the country during that period of time, so that they have this running document and they don't have to recreate what happened at that time, because the critical factor is going to be establishing a crisis standard of care so that providers are not being held to what would have been the standard of care 6 months or a year ago.